Chlamydia is a common sexually transmitted infection, or STI. It is caused by a bacterium called Chlamydia trachomatis. This bacterium infects the urinary tract and reproductive organs. Chlamydia is a global health concern, affecting millions each year. It is particularly prevalent among young adults and adolescents. Understanding chlamydia's causes, symptoms, and treatment is crucial. Often, it goes unnoticed due to lack of symptoms. Untreated, it can lead to serious health complications. These complications can affect both men and women. Seek medical attention if exposed or symptomatic. Early detection and treatment are essential. Regular testing is vital for sexually active individuals. Understanding chlamydia helps in taking proactive steps for sexual health. Public health initiatives and education are crucial in curbing its spread. Chlamydia is primarily spread through sexual contact. This includes vaginal, anal, and oral sex with an infected partner. The bacteria are present in the semen and vaginal fluids of infected individuals. They are transmitted through unprotected sexual intercourse. Even if an infected person doesn't ejaculate, chlamydia can still be passed on. This is because the bacteria can be present in pre-cum. It's important to remember that chlamydia can be spread even if there are no visible symptoms. While sexual contact is the most common mode of transmission, chlamydia can also spread through non-sexual means. This includes transmission from mother to child during childbirth. If a pregnant woman has an untreated chlamydia infection, the bacteria can pass to the baby during delivery. It's important to practice safe sex to reduce the risk of contracting or spreading chlamydia. This includes using condoms consistently and correctly. Regular testing for STIs is also crucial, especially for those who are sexually active with new or multiple partners. Chlamydia is one of the most common STIs worldwide. Millions of new cases are reported each year. The World Health Organization estimates over 100 million new cases annually. In the United States, chlamydia is the most commonly reported bacterial STI. Young people, especially those aged 15 to 24, are most affected. Factors include lack of awareness, its often asymptomatic nature, and barriers to accessing testing and treatment. Increased access to affordable testing and promoting safe sex practices are crucial. Chlamydia spreads through the transmission of the Chlamydia trachomatis bacterium. This bacterium infects the mucous membranes, which are the moist linings of certain body openings. These openings include the cervix, urethra, rectum, and eyes. During unprotected sexual contact, the bacteria present in infected fluids come into contact with these mucous membranes. This contact allows the bacteria to enter and infect the cells lining these areas. Once inside the cells, the bacteria multiply and spread, leading to infection. It's important to note that chlamydia can also be spread through oral sex. While less common than vaginal or anal sex, oral sex can transmit the bacteria to the throat. This can occur if the mouth comes into contact with infected fluids. Understanding the specific ways chlamydia spreads can help individuals make informed decisions about their sexual health. By being aware of the risks and taking appropriate precautions, such as using condoms and getting tested regularly, individuals can reduce their chances of contracting or transmitting this common STI. Section 5. The silent threat. Asymptomatic chlamydia. One of the most concerning aspects of chlamydia is its ability to remain asymptomatic in many infected individuals. This means that people can have chlamydia and spread the infection without experiencing any noticeable signs or symptoms. When symptoms do appear, they can be mild and easily mistaken for other conditions. This often leads to delayed diagnosis and treatment, increasing the risk of complications and further transmission. It's estimated that a significant proportion of chlamydia cases, particularly in women, are asymptomatic. The asymptomatic nature of chlamydia highlights the importance of regular testing for sexually active individuals, even if they feel healthy. Regular testing allows for early detection and treatment, preventing potential complications and reducing the spread of the infection. It's crucial to remember that even without symptoms, chlamydia can still cause damage to the reproductive system. Untreated chlamydia can lead to serious health consequences, such as pelvic inflammatory disease or PID in women and infertility in both men and women. Section 6. Chlamydia's whisper, recognizing the symptoms. While chlamydia often remains silent, some individuals may experience symptoms. These symptoms, however, can be subtle and easily mistaken for other conditions. In women, common symptoms of chlamydia include abnormal vaginal discharge, which may be yellow or green in color and have an unusual odor, pain or burning during urination, indicating an infection in the urethra, pain during intercourse due to inflammation in the cervix, and bleeding between periods, which can be a sign of cervical inflammation or infection. In men, symptoms of chlamydia may include discharge from the penis, which may be clear, white, or cloudy, a burning sensation during urination, similar to women, and pain or swelling in the testicles, as chlamydia can sometimes spread to the epididymis, the tube that carries sperm from the testicles, causing pain and swelling. It's important to note that these symptoms are not exclusive to chlamydia and can be caused by other conditions. If you experience any of these symptoms, it's crucial to seek medical attention for proper diagnosis and treatment. Section 7. Shining a light. Diagnosis and testing for chlamydia. Diagnosing chlamydia involves a simple and straightforward testing process. Healthcare providers use various methods to detect the presence of Chlamydia trachomatis bacteria. These methods include urine tests, which is a common and convenient method for chlamydia testing. It involves providing a urine sample, which is then analyzed for the presence of bacterial DNA. Swab tests. In some cases, a healthcare provider may collect a swab sample from the cervix, vagina, urethra, or rectum. This sample is then tested for the presence of chlamydia bacteria. Testing is typically painless and quick. It's important to follow your healthcare provider's instructions regarding any necessary preparations for the test. Early diagnosis is crucial for effectively treating chlamydia and preventing potential complications. If you suspect you may have been exposed to chlamydia or are experiencing any symptoms, it's essential to get tested as soon as possible. Section 8. Combating the invisible enemy. Treatment and prevention. Treating chlamydia is simple and effective when diagnosed early. Antibiotics are the primary treatment option. Commonly prescribed antibiotics are azithromycin and doxycycline. Complete the full course of antibiotics as prescribed. Preventing chlamydia involves safe sex practices and regular testing. Using condoms correctly reduces the risk of transmission. Regular testing is vital for sexually active individuals. Early detection allows for prompt treatment, preventing complications.